First of all, I want to remind you that dysfunction or malfunction of the kidney can have various causes. Poor diet, which overburdens the kidney, can make it function worse and lead to different signs and symptoms. The kidney also has its own emotions that can affect its function, such as fear, low self-esteem, and lack of courage. Additionally, stress indirectly affects the kidney by depleting energy, resulting in a loss of vitality and poor kidney function. Let's talk about the kidney reflexes in the back, as they are very common and can cause many problems. During an acute phase of the kidney, such as the presence of kidney stones or inflammation, the reflex is typically felt in the 9th, 10th, and 11th thoracic vertebrae. It manifests as a pain beneath the ribs, either on one side or both sides, or a piercing sensation in the middle. This pain is only present during the acute phase, as the kidney may not show any signals when it is not actively affected. However, a decrease in energy and vitality leads to stiffness in the lumbar region, which can be felt as a sense of stiffness or rigidity in the upper lumbar area. This stiffness eventually causes problems in the lower lumbar region, specifically in the L4, L5, and L5S1 discs. It results in pelvic torsion, where the right ilium moves forward and backward, causing asymmetry in the pelvis and contributing to the development of a disc herniation, typically between the L5 vertebra and the sacrum. This condition often leads to sciatic pain radiating down the left leg. This reflex is quite common. When the kidney has low vitality, it can cause a constant sensation of pain, similar to a toothache, in both glutes. People may experience numbness and stiffness in both glutes, as well as frequent pain due to kidney malfunction. Another common problem associated with the kidney is a feeling of heaviness or tension in both trapezius muscles, accompanied by pain in the area where the protruding vertebrae end in the cervical spine. This area here. This issue can lead to vertebral blockages, particularly in the first rib, and generate symptoms that are often mistaken for carpal tunnel syndrome. These symptoms can be similar to those of carpal tunnel syndrome. However, these symptoms are also influenced or contributed to by the kidney's poor functioning, which impairs toxin elimination and leads to fluid retention. The increased fluid accumulation in the hands results in higher pressure on the median nerve, causing carpal tunnel syndrome. Furthermore, the kidney can partially contribute to other, less frequent but equally important symptoms, such as the accumulation of microcrystals. When the kidney is unable to eliminate these microcrystals properly, they tend to accumulate mainly in the shoulders and, more frequently, in the ankles, particularly in individuals aged 50 and above. This condition causes pain in the dorsal area above the ankles, resembling gout. But instead of being limited to the big toe, it affects the entire dorsal region of the foot and ankle. To conclude, I want you to understand that the kidney can be effectively treated with natural medicine, including a proper diet and suitable herbal remedies.